Thank you so much, and I can say that really we are integrating cancer control services into. We're starting at the primary health care, making sure that really people there at the primary health care are able to suspect cancer patients so that they can really make that screening, make early detection, and once they suspect that a patient has signs and symptoms leading to cancer, they can refer quickly to the next level so that they can really do quick diagnosis and also initiate the treatment on time. So we can also say that really we are now focusing mainly at the primary health care on 2 diseases, breast cancer and also cervical cancer, where people at the health centers at the DCT hospital can screen cervical cancer and also do clinical breast exam and also be able to refer to the next level if they find that really a patient has got signs and symptoms of cancer. So something also interesting is that in relation with the universal health coverage is that those cancer detection prevention services are covered by our health insurance and the community-based health insurance and also the civil servant health insurance. So our people can access those services using their health insurances, which is good. So meaning that we are putting much efforts in early detection, but also in diagnostic services, make sure that really those suspected patients can also reach to those hospitals with the capacity to diagnose and make sure that and confirm that this is cancer. And also on the same time, we are also putting much efforts in having those adequate treatment services so that those patients that we are diagnosing can have a proper treatment and adequate treatment here in the country, be able to have those comprehensive cancer treatment services provided by even Rwandans. So that's where we are. Of course, it's really a long journey, but we can say that we are on track. In the future, we should be able to provide good and quality cancer control services to all our population. Thank you.
Right. Let's just bring Fidel into the conversation now. Fidel, I want to hear your view. Dr. Francoise has mentioned a few issues to do with the diagnosis. And just across the border in Uganda, the entire country that is north of 38 million people had only one diagnosis cancer machine. How essential is investment into the right infrastructure at hospitals to just diagnose the problem? How essential is it for a country like Rwanda to arrest this before you even talk about cancer as a problem?
You're right. Some of the infrastructures are not really adequate in some of our countries in East Africa. You just talked about Uganda that has only one machine. Kenya, when you go to Kenya, they have probably around 4 or 5 machines in the whole country. And Tanzania, I think, has over also 5. Rwanda has just acquired 2 machines for radiotherapy. But I just want to remind people that cancer is not only treated by radiation, but there are different modalities. Cancer can be treated by surgery mainly, and then we have where we can give chemotherapy, and also we can give radiation. These can be, used as a standalone treatment, or they can actually be combined as 3 modalities. Different countries are, doing a lot of work in terms of providing these infrastructures, and as Francois just said, in terms of diagnostic, but also in treatment-wise, we have in Rwanda managed to have different treatment modalities. We have good surgeons, mainly at referral hospitals, and we have now, as I said, 2 machines at Rwanda Military Hospital, and we can provide chemotherapy at Rwanda Military Hospital, King Faisal, and also Butaro Cancer Center. So there are different challenges that have been, we have been facing over the years, but which we are trying to overcome. And I believe, as Francois said, in the coming years, we are going to be able to treat our patients, Rwandese, but also people from across the border. We, as you said, Uganda has 1 machine, and this cannot serve the entire country. So people who are close to Rwandan borders, people from Congo who are close to Rwandan border, people from Tanzania who are close to Rwandan border can come to Rwanda for treatment, as in the future, near future, we're going to be having good quality treatment, but also highly trained physicians to care for these patients.
Dr. Francoise, let me bring you back into the conversation. One of the ways that cancer can actually be dealt with, well, depending on which strain, take for instance the papilloma virus, is actually just basic vaccination. But this can tackle close to 70%. This is, again, according to the World Health Organization. How is this being received in Rwanda? I'm reading some reports that show that the reception hasn't been as great as you actually expected. How is the vaccination program going in regards to the papilloma virus?
Okay. Thank you so much again. So let's now focus on cervical cancer, which is probably the most incident cancer in Rwanda. With breast cancer, they are the top 2 cancers in the country. I mean, regarding the cervical cancer, as you said, I think we are doing very well. With the vaccination, we are now immunizing young girls aged 12 years. So far, we have started the immunization in 2011, and now the coverage has been really very high. And I think we are probably one of those few countries with a coverage over 93% of our young girls are immunized. So, but as you know, from HPV infection up to the stage of having invasive cervical cancer, it takes around 15 to 20 years. We cannot say that probably tomorrow or after tomorrow we will see the incidence of cervical cancer going down. It takes time. So, but I can say that now we have got all those young girls immunized, and now we are also, again, because adult women did not get that chance of being immunized. So now we are capturing them through cervical cancer screening that we are integrating into the primary health care at the health centers, at the DCT hospitals, making sure that at least we can now see those precancerous lesions and also be able to stop that progression to invasive cervical cancer. So can I say that the country has put in place those strong strategies, immunization, which is being done through campaign every year, but also the immunization has been integrated into the primary health care level. At the health centers, at the district hospitals, people can go there and have the HPV vaccine, and they also get the screening. So for the screening, we are targeting those women between 30 and 50 years old. They are the ones that we are screening to make sure that we are seeing those precancerous lesions and also be able to treat them before they reach to that stage of invasive cervical cancer. So we are confident that probably in the near future we should see the incidence of cervical cancer in Rwanda going down with those very effective strategies that we have put in place.
Right, thanks for that. Let me bring in Fidel for the last comment. Fidel, when HIV and AIDS was making its rounds in the 80s in much of East Africa, many actually thought this was just witchcraft. Now, cancer, fast forward a few years later, it is also making its rounds. And if someone is in Ramagana or Musanze, in the rural part of Rwanda, how do you pass the message on that this is not a new phenomenon? This is actually called cancer. This is how you can avoid it. This is how you can evade it. There's treatment, there's chemo, there's all these things. What are you doing about this?
Right, you're really right. In the past, people thought that different diseases were due to witchcraft, and cancer also came along. And as I can tell you a short story, I was in a clinic a few years ago, and I just received a patient who had a very small mass in the breast. And I asked her, why did you come this early? How did you manage to detect this cancer early stage? And she told me, you know what, I heard over the radio and I palpated my breast and I found this and I was like, this is not normal, so that's why I came to your clinic. So I think one way to do that is to raise awareness through different modalities, including coming to the media and trying to work with the media to spread the news, but also given the fact that Rwanda is well structured in terms of administration, there are people who can work in the cell, in the village, spreading the news about the cancer. And RBC and the Ministry of Health have done this so far, targeting mainly the top cancers we have, cervix and breast. And I think this is going to spread to other type of cancer that can be preventable. As you have said, most of the cancers that we have right now can be preventable. There are caused by viruses or lifestyle changes or, you know, different chemicals that we are eating or we are not doing exercise. So if this message is transmitted all over the country, we believe that people are going to come out of the myth that out there that cancer is due to poisoning or witchcraft or whatever reason they are giving that are not scientifically proven. So this will be through media, through messages of awareness. We have seen so far there are different civil societies that are spreading this gospel all over the country, being in pediatric patients, being in patients with breast cancer or any other type of cancer. And we believe that through these messages, through media, through mouth-to-mouth sharing, people are going to have the knowledge about cancer, and the trend is going to probably go down as we change our different lifestyle and preventing what it can be preventable.